Over to you, ma'am.
Thank you very much. So I am very happy to speak after Dr. Parvati and Dr. Riyas. They were my dear students and precious colleagues. So when I was asked to talk on this, I thought I'll take you through two cases. One girl, 30 years back we had Chakra. We used to call her sugar pot, Chakra Podam. And every time, at 1 year she was diagnosed and they were fighting the adversities. Each time a hartal or something comes, she lands up with decay because her insulin was stored in a cool bar. The cool bar won't open. They had no refrigerator and there was no pen available. And lot of adversities they had to face, and we persuaded to change her name during school entry and she became Neetu. But by 13 years her story ended. She ended up with all the complications. And that is, she's an example of the yesterdays when there was lack of empowerment and psychosocial support. But look at Amy. She is an ambassador actually, and she comes for regular checkup. She clears her doubts about parties, sick days, and parents are very supportive. She has interesting hobbies. She is a celebrity, and she has well-controlled diabetes and ample psychosocial support, and even she is a celebrity. And so, when I am thinking of psychosocial support, what is empathy and sympathy? We can all sympathize. What is sympathy? I know how sad you are, but I don't feel it. I have to step into the shoes of that person to know what is. Can I have a hand? Thank you. Yes. You say, am I audible? Okay. And so, this one. See, one is sad, the other is, I am sorry about you and all, I feel sad for you, but he is not feeling the sadness. Empathy means we feel the sadness, that is it. And when I think of psychosocial support, it is empowerment. I have taken 14 numbers. I'll tell you why 14, the importance of 14 by the end of this. So there should be patient education, family education, dietary education, so many things Dr. Riyas and Dr. Parvati were telling also. So empowerment one, at the start of the diagnosis, takes them through the 4 stages of grief. Denial, anger, they may be very angry with you, they may go to depression, they may bargain and go to different system of medicine to confirm whether the child gives all these things. Finally, they will accept. So take them through the grief stage. They may even blame you, they may not believe you, but these are the stages which we have to take them through. And empowerment too is what they were all telling about. It is not a single entity. I think the slides are all blurred because of this problem here. All slides were blurred, not only mine. So type 1, type 2. So if we are not telling them what it is, they will get wrong advices from other parents or some quacks and all. So what is type 1, what is type 2, what is monogenic, and even type 1.5, the late autoimmune disease, diabetes of the young child, gestational, neonatal, so many terms are there. And one child we had presented, published, following cytomegalovirus, the child developed the diabetes, destruction of the beta cells. Then, what are the symptoms and why? Dr. Parvati was highlighting this. So, when there is glucose variability and hyperglycemia, there will be osmotic diuresis. So, polyuria, polydipsia, weight loss. And the empowerment is that if the child is having ketosis, if the child goes to abdominal pain and nausea, most likely the child is ketosis. And if he is hyperventilating, then he is in ketoacidosis. So we have to empower them to teach these things. That is the support we have to give. Then get to know about insulin. And we may think that insulin has a role only in carbs. It has a role in fat. Insulin preserves the fat stores. And we know that hyperinsulinism, people are very fat now because of fat storage. And uptake of amino acid. This again, insulin is needed. And then there are certain stages, the preclinical stage, clinical diabetes, then there may be honeymoon phase, and the HbA1c may drop and the insulin requirement may drop. So people may think that they are cured, it has spontaneously disappeared, or they may go to some quacks and they may say that it is cured, but it is only a stage, so we have to empower them this. And then people ask, should I be on a diabetic diet? I say there is nothing called a diabetic diet. It is a disciplined diet which all of us may have to follow. So they have to go for the 3 major meal and 3 snacks. Time wise we have to teach them what to do. A bedtime snacks. And then cut down the carbs to less than 50% and hike the protein to 20% and optimum fat they should have. So the green, yellow, orange, red vegetables here. Then go to your protein. Give more importance to your pulses, the nuts and the non-veg and all. And then only concentrate on the energy food. We usually start eating with the carbs. That is the thing. And little bit of dairy products they need. So this is similar to the plate method, but fruits are there. So the question is, can they take a fruit? My answer would be, if the medication is optimum and the child can exercise, the child can take a fruit. But you have to choose the fruit wisely, that's it. And this is also very important for the micronutrients. Vitamin D deficiency is very common. The bone health, everything was said. And also the health of the gut microbiome. We should have a balanced, wholesome diet so that there is no dysbiosis in our gut also. And then how much carbs? See, when you take carb, the blood sugar variability is so much. The next is alcohol, and with fat and protein it is not much. So we have to plan it accordingly. And see, in India, 71% of the energy is from carbs, 76 in rural, whereas in Caucasian it is only 40, less than 40. And those who take more carbs have more obesity, more diabetes, no doubt. And then see the glycemic variability. Eating rice before vegetables, blood sugar is shooting up. Eating rice after vegetables, the variability is less. So these are the things. I need not tell them I am sorry, I am feeling for you, but we have to empower them. This is my point. And glycemic index everybody is looking for, and any dietitian can give you all these things. But this we know. But what is the glycemic load? That matters. See, more than 20% is there, and the portion size also. Glycemic index is low, but I am taking a large portion size means my glycemic load will be more. So we have to calculate glycemic variability, glycemic index and glycemic load. And see, half a banana, half a mango, that is all because it is high in carbs diet. And this is another thing, different diets. When you take a mixed diet as I showed, and so low glycemic index, low carb content, that had the lowest glycemic variability. So we have to choose wisely and empower them to read the food labels. Nowadays nobody reads, no? Even in your Maggi, it is written there, it is for 2 servings. And people take 2 Maggis at a time. 2 people should share, or it should be for 2 servings. We never bother to read all the food labels. So we should have the habit of making. Anything more than 20% is a high. And it is written there, trans fat is there. All those things, it is written there. It is too high in fat, salt and sugar and all, it is written there. And this is what Dr. Riaz was trying to tell you, 80 to 180, time in range. For that you should make them learn to count the carbs counting. And this carbs counting is also important to know the exchanges. For example, in a school going child, 1 unit of insulin can digest 15 grams. So 15 gram exchanges we have to teach them. And for a smaller child, it is 30 grams. Like that, these are the empowerment that we have to give. Then, what about certain unique foods? They say, no, raw banana, then sweet potato, green jackfruit, all. Is it true? They are all naturally occurring amylase resistant starch. So the glycemic load will be low. It will go to the colon and get fermented to short chain fatty acids, which is a very good fuel for you and your colon health. So this has some meaning in it. And can my child take exercise? No form of exercise including competitive sports should be forbidden to the child. They have the right to enjoy childhood. This is what Dr. Riaz has made it very easy. And so what we have to do, total dose of insulin may be reduced by 10 to 15%, or they can take more carbs or sugar. A fruit they can enjoy on that day. Anyway, they are under monitoring, they are taking the medicines basal bolus, not 2 times insulin as in the past. And what about insulin on sick days and birthdays? The important thing is that the portion size. And I remember celebrating a birthday of a child with in our ward. And once I told her, you should go to the school and tell nobody should bring cakes and chocolates for birthday. They should bring pencil box, pencils, etc. I told the parent also. And they can't take 40 days chocolates, no, just because everybody's birthday is coming. And one day when we went to the ward, she gave pencil to everybody, including nursing students. Then we asked what happened. It is her birthday. So the father brought a lot of pencils and gave. Then we brought a cake and cut it and gave to the child. And I remember one adolescent girl telling, don't cut the pizza into 6, I can't take 6 pieces. Please cut it into 4. She has no idea of a portion size. So portion size, this is what we should be telling them. And management and infections, they think that they can skip the insulin, but stress hyperglycemia, sometimes it has to be increased. And after Dr. Riaz has started his clinic and the helpline, no child in SAT is readmitted with a DKA. But the other case, every time they were readmitted. And now that they have the helpline, it is, and then is my child growing normally? We have to teach them self-care, food care, all this dental, eye, all this we have to check. And what is the quality of life of the child? And for that we need the log books, insulin log book, the diabetes log book, and screening for complications. And the different type of complications. And these 2 children on insulin are, she's gaining height and weight, and this child is trailing. So what was the reason? One child was lack of exercise, overeating on insulin, and insulin is an anabolic hormone. And here it was because of autoantibodies to thyroid. So the child was, the short stature was more. That means the child developed hypothyroidism. So we have to do all these things. And the empowerment, 14th point, that is the Mitai program, which Dr. Riaz and all are having in the government sector. Social life, privileges at school, government assistance, but not yet included under the RBSK program or disability. They don't have a disability certificate, but I at least think that we should give them a separate ID card, no? Which should be within there, that this child is a diabetic child. And in case he is found unconscious or clouding of sensorium or hyperventilating, they have to do these things. And so 14, any idea why I took 14? November 14. Yeah, that is the World Diabetes Day. It is also Children's Day. And let them make them ambassadors and celebrities, not to be sad and crying about that my child is having it. We should empower them. So psychosocial support, we have to empower them about all these things. So 14 points I have given for food for thought. I hope we'll be able to make a major difference in the quality of life of the child and the parent if we are, instead of sympathizing, if we can do all these things.